Hello viewers, today I will tell you about the subclinical hyperthyroidism.
As you know, thyroxine is produced by the thyroid gland that is present in front of our neck, and thyroxine has multiple actions in our body, and the optimal amount of thyroxine should be produced by the thyroid gland on daily basis. When this amount exceeds, then there can be the problem due to overproduction of the thyroxine, and that is given the name of hyperthyroidism. And what is the subclinical hyperthyroidism? According to American Thyroid Association, if the level of decreases below 0.4 milli-international unit per liter, then we label it as the hyperthyroidism. But when the level is below 0.4 but the FT3 and FT4 are within the normal range, then we label it as subclinical hyperthyroidism. Subclinical hyperthyroidism can be the symptomatic and can be the asymptomatic. Sometimes it is diagnosed on routine investigation, and sometimes it is diagnosed when the patient has the symptoms and signs. But doctor or healthcare provider or specialist has to decide when to treat the case of subclinical hyperthyroidism. The mandatory clinical signs that needs the treatment of the subclinical hyperthyroidism are atrial fibrillation, osteoporosis diagnosed on the basis of the DEXA scan, and if the patient age is more than 65. These are the three important clinical signs or diseases every healthcare provider must be aware and have to treat if there is biochemical evidence of hyperthyroidism. But if these are not present, but the clinician must know that he or she has to closely monitor the patient so we can prevent the patient from subclinical hyperthyroidism to full-blown or overt hyperthyroidism. Because if there is the development of the hyperthyroidism or subclinical hyperthyroidism, then patient can develop lethal clinical diseases like osteoporosis. With that, patient can face the fracture of different sides, different skeleton area, and patient can develop the atrial fibrillation or heart failure. Patient can develop the psychosis, or some patient can develop the pyrexia of unknown origin. A lot of things are waiting to present if we will ignore the clinical hyperthyroidism. We must be aware about the normal range of the thyroid hormone, and we must be exactly aware about the definition of the subclinical hyperthyroidism. Thanks for watching, and don't live without LSCS.